The reason they're calling it a fever is perhaps because North Korea doesn't have the testing capacity of other countries. We've seen that over the pandemic. They've only conducted around 60,000 tests. So when they say 350,000 people have presented with fever since late April, it seems the system perhaps cannot keep up with it in terms of diagnosing COVID. We do know the situation is very, very serious indeed. First of all, just the facts. We're hearing about it on Korean state media. It's not the most transparent of places, but when they're coming out and saying this, you can be sure it is a pretty bad situation. And the second sign is that Kim Jong-un has been pictured at the helm of this. We've seen images of him addressing work meetings of the Politburo, going to the Epidemic Prevention Center, and his comments in state media saying that Pyongyang was now the capital of this outbreak and been revealed to be a vulnerable point, and he called on the development of treatments at a lightning pace. So this is very serious indeed. North Korea doesn't have a vaccination program. In fact, it refused vaccines when it was offered them by COVAX, the vaccine sharing initiative, and China. 3 million vaccines rejected in September. They told them to give them to needier countries. North Korea may now be the one in dire need, really. And we could be looking at one of the worst COVID catastrophes of the pandemic so far.